Hello, everyone, and welcome. We are so excited to bring you all in to the very first webinar with Dr. Eftekhari. You are joining a webinar on UltraClear. So you're going to be learning about our brand new laser, and we have a lot of educational slides to show you, to talk to you about all of what UltraClear is. Dr. Eftekhari is going to show you real patient results. You're going to get to see a testimonial of one of our very own patients. A lot of great visuals. And then at the end, we are actually live. It is Wednesday, June 4th. So we are going to be open for live Q&A. So you can ask Dr. Eftekhari any of your burning questions live from the comfort of your home. So if you have any questions, you can use this little Q&A feature down here in Zoom and pop them in anytime, and we'll get to as many as possible. And ideally, they're about UltraClear, but you can ask questions about anything because, of course, Dr. Eftekhari does lots more than just UltraClear. Otherwise, this is being recorded, so we will send the recording out to everyone this weekend. So if you've missed something, don't worry, you can watch it again, or you can always forward it to any friends or family if you feel like they also need to see the same education. So that's kind of our housekeeping. I just wanted to give another minute or two for you all to get situated. You look like you're mostly here, so I think we can go ahead and get started. So, welcome everyone to the very first webinar with the Eyelid Center of Utah and Dr. Eftekhari. We are very excited to be here today to introduce UltraClear Skin Rejuvenation. It is a revolutionary laser that's changing everything and brand new to our practice. So Dr. Eftekhari today is going to take you through a little educational slide deck, and then we will open up for live Q&A, and then stay tuned to the end to hear about our promotion. So before I hand it off to Dr. Eftekhari, in case you don't know him, let me give you a little rundown. The man, the myth, the legend. But Dr. Eftekhari is a double board certified oculofacial plastic surgeon. That is a mouthful, but he really is one of the best in all of Utah. He is extremely respected by his peers, maybe because he did his fellowship at the #1 ophthalmology center in the country, the Bascom Palmer Eye Institute. He's also published over 40 peer-reviewed articles and textbook chapters. And today we're talking about UltraClear, which is a new laser, but he also specializes, of course, in all types of eyelid surgery, facial rejuvenation, and injectables. So without further ado, Dr. Eftekhari, the floor is yours.
All right. Hey, everybody. If I haven't already met you, welcome. I hope to meet you someday. And if you are one of my patients or friends that's on the webinar, welcome. It's nice to see you. One correction, Lisa. I did my fellowship right here in Utah with a guy named Rick Anderson. Rest in peace. Rick was a great mentor and also the biggest Utah Jazz fan you'll ever meet. All right. So let's talk about UltraClear. I'm really excited about it because it's just been I feel like I've been searching for something in my practice that is just going to fit into that missing piece of what I needed to help with skin tightening. And this has really fit the bill. And I've just been like talking about it nonstop. So I'm excited to welcome you guys in and talk more about it today. All right, so let's start this video, give you guys a little intro to
the first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs. Balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass. Delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types. The first.
So that was a little salesy, I know, but I think that's super important. First thing is that For many, many years, there really have not been options for laser resurfacing for people of color and for people with different skin types. So you could be somebody who just has more of an Italian or Mediterranean background, like myself. My family's from Iran. I kind of have olive skin. And honestly, a lot of the lasers that we have been previously using could have been, harmful because they can cause darkening of the skin or lightening of the skin afterwards. That part that you saw in the video there, where there's kind of the blue going in with the red, we're going to go a little bit more into that. And that's kind of like the critical difference for why this laser is a differentiator and why I think it's really exciting. So one of the first questions I always get is, am I a candidate for it? I take care of a lot of different kinds of patients, young and old patients, and it's sort of hard to know, when is the time for a laser or if you need a laser. So that's one thing that I think is really versatile about this device is that it can be used for people who are younger, who just have a little bit of pigment in their skin or some brown spots, things like that, or some fine wrinkles because they just get a lot of sun. It can be for older patients who have really deep wrinkles, like around the mouth, under the eyes, horizontal lines in the neck, where you can treat those areas without necessarily doing a surgical procedure and really shrink down some of that skin. And then everything in between, which is, people in their 40s and 50s who have lots of brown spots, age spots, sun damaged skin, which being at high altitude here in Utah, especially in a beautiful day like today where it's 80 degrees and sunny, you do get a lot of UV radiation, and that does take its toll over time, no matter how much sunscreen you put on every morning, how much you wash your face and try to take care of your skin. These things unfortunately do happen. So the other question is, why would I do this laser over something like a CO2 laser or other types of lasers? And for me, the biggest reason why I brought this laser into my practice is downtime. So this laser can be done in my office under topical anesthesia. So what that means is you come in like 45 minutes early, we put numbing cream on your face and your neck if that's where you're having a treatment. We let that sit, just chill and hang out on your phone for a little while. And then we're able to do the laser treatment, even at the very advanced levels, which you'll see later in the presentation, including laser coring, just under topical anesthesia. You do not need to take a Valium or an Ativan. You do not need to go to the operating room and be put under general anesthesia. And for some other lasers, that is the case. And almost all of my patients just walk right out and drive themselves home afterwards. And that's a big advantage because not everybody has somebody that can drive them in for a procedure that's just related to skin tightening and drive them home. So for me, the downtime has been really huge. So this is kind of fun. So take a look at this graph and try to figure out, like, what is your skin type? I'm probably somewhere in between a 3 and a 4. A lot of my patients here in Utah are type 1 and 2. And I see a lot of type 5 and type 6 patients. But the really great thing about this laser is the whole right side of this chart here is not a candidate for some of the other laser types like CO2 because of what I was talking about earlier. It can hyperpigment the skin, meaning it darkens after the laser treatment, or sometimes hypopigmented, meaning it lightens after the treatment, which of course, if you've got pigment in your skin, you do not want that. And so this laser really is across the spectrum in terms of what you can treat. And the way that we do that is modulating the treatment parameters, because there's like a lot to this device. There's a lot of different things it can do. And that's what allows us to treat the different skin types. And it has been FDA approved for all skin types, which is really unique in the device and resurfacing realm. So if you're going to remember one thing from the presentation, I think this is kind of helpful. The laser can treat things at a superficial level, and we'll show some of those results. So make sure you put that in context. If you look at it before and after and you're like, well, that doesn't look very different. Well, it might have been a superficial treatment where the patient didn't even have topical anesthesia. It was done in 10 minutes and they walked out and they barely really had much of a downtime. That's going to be your superficial category. Your advanced category at the bottom there is going to be UltraClear mode with laser coring, which is going to be for a lot more sun damaged skin, deeper wrinkles, lines around the mouth, lines under the eyes. That's going to have more downtime. We're talking 5 to 10 days. And I'll show some examples of that. But I usually tell people it's about 5 or 6. And then the middle treatment is somewhere in between those two things. So that's the really critical thing, is depending on what we're shooting for, you can have different levels of downtime. But overall, the downtime with this laser, in my experience, has been less than other types of lasers like a CO2, where you might be in quite a bit of discomfort for 1 to even 2 weeks afterwards. With this laser, what I tell people is you're spicy on the first day, you're feeling tight and getting swollen in the next couple of days. And I'm talking about the deepest treatment here, the bottom category. And then day 4, you're starting to see light at the end of the tunnel. Day 5, you're starting to peel, you're putting sunscreen on, you can go to the gym. And most people are able to kind of, do most of the things they want to do in and outside the house around day 5 or 6, depending on the type of treatment they get and depending on their individual skin. But just the overall average, people are healing after this laser to where they can feel pretty functional with the deepest level of treatment at around day 5 or 6. So we don't want to get too much into the nitty-gritty of the science, and I'm happy to answer more questions about that if you'd like. But think about the skin as having different layers. And the reason that the UltraClear is so unique is that it's able to target those different levels with the different modes that the laser has. And I would turn the laser on if I could, but it gets kind of loud, so it's going to kind of distract from the audio. But in the screen here, it kind of goes through different modes. For those of you that have had the laser, you kind of know what it looks like. But the top layer of the skin is what we're targeting with that 1 to 2 day downtime treatment, which is called the 3D miracle. The middle layer of the skin, the epidermis and the epidermal dermal junction, is what we're targeting with ultra and clear mode, where that's what you would kind of compare to if you've heard of something called fractional resurfacing. That's what that mode is going to be targeting. And then if we go lower in the skin, that's where laser coring can be useful for deeper wrinkles when appropriate. You wouldn't want to necessarily do that in a young person with really, really tight skin. So that's why you want to modulate these parameters depending on what parts of the skin you're treating. So real quick here, I want to kind of explain this. So the technology and the reason this laser is unique is because other types of lasers are delivering straight heat down. So think of all this being red. The UltraClear is delivering heat alternating with cool. That's why it's called a cold fiber laser. It's got that designation from the FDA. The reason that's important is this is what allows it to treat people who have skin of color, because it alternates the heat with the cool. So it's not causing as much thermal injury and damage to the skin, because that's been correlated more with the issues people can have afterwards, like the hyperpigmentation. And so that's really, it's a really critical thing to understand is we can modulate exactly how much cool we want to deliver with heat as the laser is targeting these different areas of the skin so that we can be safe for people who have skin of color. And then I like this video because it kind of just shows what it looks like. So what does a fractional resurfacing mean? So fully ablative laser is what you might have heard about in the past. That's less common today. And that's when you're just taking off the whole top layer of the skin, kind of like honestly, like a burn victim or something. You're causing an intentional burn. Fractional resurfacing is what you're seeing here, where the laser is going and individually targeting different areas of the skin. And I can kind of punch in what percentage of that circle that you see here is actually being lasered with this technology, so that we're only targeting a certain percentage of the skin to allow for healing over, so that it's not like you've taken off the entire top layer of the skin, which is a fully ablative laser. Okay, so let's just start with one of my own patients. So this is a treatment called UltraClear, which is going to be in that mid to advanced category, moderate to advanced category. No laser coring was done here, which is something that you could consider for some of the wrinkles in these areas here, and even sometimes under the eyes. And so this was purely UltraClear, and this is just 10 days afterwards. And I mean, I think she's had a fantastic result. And you can kind of see from the side view how much pigment was in the skin, just that sun damaged skin, that freckling look, and some of these lines and around the mouth and under the eyes. And we also treated the neck. And you can see it's a little better focused on this image, but you can just see the difference. I would say she's actually still a little bit red and swollen at this 10-day mark, but you'll see her 6 weeks out here in this video. So we'll just play a little bit of this.
At this point, I'm 6 weeks, about 6 weeks out from from my treatment, and I think my skin looks pretty fabulous. My wrinkles are way less noticeable. I smoothed out my jowl lines, and the age spots that I had on my face, they're all gone. And I think that the texture of my skin is just fabulous. I really, really do like that. Yeah, I think I look pretty terrific. I love my results, and I feel like I look about 10 years younger, which is a huge confidence builder. I love that. I'm 62, almost 63 years old, so I think I look pretty good. And
So if you want to watch the whole video, we are going to post the webinar afterwards, but she does go a little bit into downtime, and I think gives a very honest assessment of what it was like to go through the UltraClear treatment. Okay, so let's go through some of those categories. We're going to start with the most superficial. So again, pull your mindset back to that slide I said to pay attention to, where the before and afters for these might not pop off the page, but remember the patients had basically no downtime. A couple days of their skin being a little bit red and peeling, but not necessarily the significant swelling that our previous patient that I just showed you had, for 5 or 6 days. Again, just to review, those before and afters you saw were just 10 days after the treatment. And so she was, I think her skin was looking a lot better, even just a week and a half later. So the superficial treatment, the 3D miracle treatment, is essentially trying to pull out pigment from the skin, from the stratum corneum. So I'm not sure if you can see my cursor here, but just kind of these areas here, you can see how it just pulls out some of the pigment. It's not treating deep lines, but the downtime to the treatment is very minimal. Here's another example in a younger patient, just clearing up some of these areas around the cheeks. And a couple more pictures here. This is sort of the type of skin damage and sun damage that I see a lot of in my practice, because again, we're in a beautiful place with mountains and altitude. And so we get a lot of this sun damage type stuff to our skin, and it's kind of insidious. It happens over the years. Even if you're spending a ton of time, effort, and money on sunscreen and other products every day, just sitting in your car, you're going to get this kind of sun damage. And this is the 3D miracle treatment, and it's pulling out a lot of that pigment. Again, just some of the improvement in the pores and those areas. We're going to go through a lot of pictures, so if I'm going through them quickly, feel free to look through them more carefully on if you look at this later. This is called tech neck. I just learned that term, but basically, we're always sitting there staring at our phones, creating horizontal lines in our neck. Vertical lines in our neck are a little different, and I want to stop there for 1 second and just say, a laser is not a facelift. It's not really fair to expect it to deliver the results of a face or a neck lift, and it's not going to lift the skin in any way. The purpose of a laser is complementary, in my opinion, to some of the things that you're trying to achieve with surgery if you have significant skin laxity. So with surgery, we're pulling things up, but we're not necessarily improving the skin or tightening the skin. With a laser, we're tightening the skin, but we're not necessarily pulling things up. I think this is a nice example of how a simple laser can just make the neck look a little bit better, a little bit lighter pigmented, and not have as many of those horizontal bands. All right, let's move on to the moderate category. And this is where we get into things like scars and acne scarring. So you can see kind of before and after here, patient with quite a bit of acne scarring. This is just one treatment. It's 5 days afterwards. This is called clear. So that basically means it's like a fractional resurfacing of the top layer of the skin. And you still see some of those areas, but this is only one treatment, and it's only a couple days afterwards. The thought is that at least on a microscopic level, you still build collagen for a few months afterwards. But I think with one treatment, this is actually a pretty nice result, especially for something that had very minimal downtime. This kind of reminds us back to that skin type diagram we went through earlier. You can see that even in skin of color, which has, again, not been something that we've really had a laser for in the past, helping with some of these pores and these lines here to just improve the skin. One of the things that's kind of funny about before and afters that really doesn't get captured, but that I hear a lot from my laser patients, is across the board, people tell me their skin feels softer and feels better. And that's not something that you can capture in a photo, But you can kind of imagine here how the skin just has a little bit more of a natural glow to it. It just kind of looks softer. And that's what people have been giving me feedback about, that they really like about the laser. And I love that feedback because it's so common here for our skin to feel dry where we are in Utah. Okay, so another example of what you can do with clear. So a lot of people have these spots. They can be called age spots, sunspots, liver spots, which is kind of a weird term for it, but basically brown spots in the skin that are kind of splotchy, not melasma. Melasma is something that you can get when you're younger and especially can get worse during pregnancy if you have kids. That's a different entity. This is more sunspots that can occur over time with age or even in young patients that just stays about the same. But what you can do with a superficial treatment is just kind of pull that pigment out. And you can see how there's an additive effect to having more than one treatment, where you're just pulling more of that pigment out so that you get less of that brown discoloration. Another example of that, we'll kind of see, I think, both cheeks of this patient, but just that generalized brown discoloration in the cheeks and much better, although not completely gone after two treatments there. Again, much better, not completely gone, but less noticeable because it's not in that bright spot in your cheek. This area of the cheek is called the OG curve because that's the part that really pops when people are looking at your face. They catch this part of the cheek, and then this part of the cheek and jawline has more of a shadow to it. So this is my specialty. So I'm an oculofacial plastic surgeon. My practice is entirely eyelid surgery, forehead lift surgery, fat grafting surgery, and lower eyelid surgery. And this is the number one reason that I wanted to bring this laser into my practice, because I feel that I can achieve really good results with lower eyelid surgery, but some people have that fine crepey skin, and it's not safe or smart to just go and cut out skin from under the eye. That's something called a skin pinch, and it's something that I very rarely do. And I discuss that with a lot of patients because they come and ask me, or they kind of lean in and they pinch that skin and they say, can you just get rid of that? Well, the reality is if you do that, you're just going to pull the eyelid down and you're going to have a big problem on your hands. And I unfortunately see a lot of revision cases in my practice where surgeons who were chasing after this skin just cut it out. Now there are other options we have, and I think that's where this laser really fits into my practice, is for people that have that generalized crepiness of the skin, whether it's worse when they're smiling or whether it's just static wrinkling of the lower eyelid skin when they're not smiling. The laser can help to shrink and tighten those tissues, as opposed to doing, I think, something unsafe, which is to cut the skin out below the eyes in a skin pinch procedure. There are ways to safely do a skin pinch, but it has to be done in the right hands, and you have to really think through it when you talk to your surgeon. It is not as simple as take that skin and just remove it, because that will cause you a big problem. Okay, so different topic here, scarring. So people can have scarring on their arms, people can have scarring around their eyes, people can have scarring on their face. Scar tissue can occur for a lot of different reasons, but what the laser can do, it's not going to eliminate the scar completely, but what it can help do is kind of help build collagen under the scar to help it look more like normal skin. And you can see this is a nice result where the scar is very well delineated before, and after one treatment, it's just a little softer. It's like it's weakening the scar. And then after a second treatment, you see it just blends in a little bit better with the skin. And I'm using this for scarring in my practice, and I absolutely love it for that reason. This is another example of just that pigment change in the skin and the cheek area there. And then another example under the eyes. So basically that lower eyelid wrinkling, especially when it's down by the cheekbone, cannot chase after that with a skin pinch. Very difficult to do and very high risk from a surgical standpoint. But chasing after it with a laser, you see we didn't get rid of all of them, but definitely softer, less aged looking. It's a nice way to do it. And there's, you're not going under anesthesia for something like this. And then this is an example of acne scarring. So a very common thing that you can get, but down here, around the chin and the cheeks areas. And this is something that usually we use something called the ultra mode for this, that helps to just build collagen underneath scarring. And then again, just those fine lacy wrinkles in the cheeks. This mode, the clear mode, can kind of help by fractionally resurfacing that whole layer, soften those areas and just make them look a little bit less wrinkled. This is a bigger scar in the middle of the skin, as well as this red spot there. And you can just see kind of before and after is a little bit of a tighter area down here. And again, these are some really deep scars. So you can see that there's kind of a texture or a depth to these. And even just after one treatment, there's some softness to that area. And one thing I really like about this laser I want to just point out is when you look at photos on Instagram of people's before and afters, this is my pet peeve, but you have to look carefully to see if the surgeon or the provider is actually using consistent lighting between the photos, because it's really easy to make things look better by popping a huge flash camera onto the skin because it hides and masks a lot of things. One thing that I like is that with some of these photos, they're pretty consistent as far as the lighting that gives you a better idea of what you can actually achieve. So again, another example of these vertical bands, these are platysmal bands. That's not something necessarily that a laser is going to help with. It might soften them some, but you can't expect those to go away with a laser. But some of these horizontal bands and horizontal lines, you can really soften. And I like that about the laser. Again, acne scarring, just a one treatment, 1 month later, just in that area down here. And then these are some really nice pictures. Around the mouth, you can see the improvement after the UltraClear treatment, and also underneath the eyes, just that real softening of the skin under there. This can even be used for kids who have scars, just kind of a little plug for that. And this is another one where we're just kind of talking about how it can remove pigment. This is going to be kind of the more moderate to advanced mode with UltraClear, similar to the before and after that I showed for my patient, that just really pulls a lot of that skin pigment out. This is an example, I think, of some tightening of the jowl area. Again, I don't want to overpromise on this kind of thing because it's not a facelift, but the jowl area is the main reason people do consider having a facelift. If you've seen these pictures of Kris Jenner that have been going wild on the internet, you've seen how that just tightened that area, tightened the neckline. That's what a facelift can accomplish. Even a little bit of softening of that with a non-surgical procedure is nice. And again, another example of just improving the pores, improving the skin in these areas here. I like this one because you can see some of these lines around the mouth. They're not gone, but they are softened. And I think that's, hard to do with surgery. You can't really just take the skin and cut it out and make it look tighter. You really do need this device. That's why it's so complementary to what we do from a surgical standpoint. So now I want to get towards the end of our talk by talking about laser coring. So this was one of the biggest reasons that I wanted to bring this into my practice, because a resurfacing laser like an erbium or YAG laser or a CO2 laser, it can do some of the things that we talked about in terms of taking off that superficial pigment in these areas, again, at some of the cost of downtime and pain. Some of my patients have told me their experience after having the CO2 laser. It's been like 1 to 2 weeks where they were really on the couch in a lot of pain. And that has not been my experience with the UltraClear laser. But what the UltraClear laser can do that those lasers cannot is something called laser coring. So the idea of coring the skin and having it heal and tighten the skin is not a new concept. It's been around for a while, but there really hasn't been a device that's kind of combined these two things, where you use the laser to make those cores, and then on top of it, so the laser coring goes deep, and then on top of that, you do some of the resurfacing. And that's why I really like this, because it can do both of those things. And I just had a patient on Friday where we did this for the under eye areas, and it doesn't necessarily mean I have to go get a whole different device and bring it into the room. It takes me 2 seconds to just switch modes, put a layer of laser coring down, and then on top of that, do the UltraClear on top to help with the finer skin resurfacing. And so let's take a look at some of these kinds of results. And so here's a little animation about what laser coring does. So that's the metal thing you saw in Dr. Friedman's video that sits on your skin while the laser puts these cores into your skin. So important point, these holes that it makes in your skin are going to be bigger than the tiny little holes that are made from just the resurfacing, the ultra mode or the clear mode. And so you can actually see these holes anywhere from 2 to 8 weeks after the procedure on your skin if you're looking carefully. They can be covered with sunscreen or makeup 4 days to 5 days after the procedure. So they wouldn't necessarily be visible to others, but you can see them. And basically, as your skin has some laxity, it tightens that laxity because when it heals those little holes, it tightens the skin around it. Think about it like if you have cling wrap and you got it on your kitchen counter and it's just got those little wrinkles in it. If we put little holes in it and they all healed together, it would be like you pulled the cling wrap tight and it's just flat against the surface of your counter. So these are some examples of laser coring. So you can see how it's clearing some of these areas, even some of these horizontal lines in the neck and also under the eyes. Another example around the jowl area, not necessarily fixing the jowl, but some of those marionette lines that you get going down this way, straight from your nasolabial fold, and just kind of softening those areas and tightening those areas. Another example of that just softens those areas. Again, this is going to be a more of like the 5 to 6 day, sometimes up to 10-day recovery. But you can start using sunscreen at like day 5 and being out and about. It's just a matter of how much do you feel like you want to be in public right afterwards. This is a nice example of perioral lines. So those smoker lines, people call them, or barcode lines is another word for them. And just how the laser coring mode, it's going to go right into the very depths of each of these wrinkles and create a little hole that your body has to heal. And then on top of it, we're going to do the superficial resurfacing you saw in the video with those little tiny circles. And just some side view of the same patient. Under eyes is an area where I use laser coring a lot, and I think that's where it's so helpful because, again, I can do a procedure that's going to help with bags under the eyes or dark circles under the eyes. But if somebody has wrinkles, especially spread down here along the cheekbone, and that's kind of where they gather, that's not going to be an area where it's safe for me to just cut them out. I'm certainly not going to make an incision straight on the cheekbone. And trying to make an incision right under the eyelashes, which is what's called the skin pinch, and kind of pulling that skin up. Well, turns out when you do that, sometimes it actually pulls the whole eyelid down. And trust me, that's the last thing you want. You'll be in my office and we'll both be, getting emotional about what we're going to do to try to fix this, because it's a very difficult thing to revise lower eyelid retraction, which is pulling down of the eye when somebody gets too much skin removed from under the eye. So that's the end of our presentation as far as what the different modes are. I think Reese is going to jump back in here and talk about what we have available for those of you that came on and joined the webinar. Thank you so much for taking time out of your day. I know it's kind of a busy time of year with school letting out and things like that to join us tonight for this, but I just want to say I'm super excited about this. I love talking about it, and it's been something that my patients, I think, have appreciated, that we've been able to bring this in and offer it to folks, because we can do it right here in our office in Draper, and you can drive yourself. It's all under topical anesthesia.
Absolutely. Thank you so much, Dr. Eftekhari. It was so helpful to hear you explain it and go through all the details, and I hope you all feel the same way. So I see a couple hands in here. If you guys have questions, this is the time to pop it in the Q&A. Let me go over this promotion real fast, and then we'll get to the Q&A. So, like Dr. Eftekhari said, for those of you that were here, we have a really good promotion for you. If you book a 3D Miracle treatment package, you're going to receive 20% off the package plus another 20 units of neurotoxin complimentary. So that's a really good promotion just for all of you that decided to spend your Wednesday evening with us. So with this, and now it is time for the live Q&A. So if anyone has any questions, this is the time, and let's get right into it. So here's a good one. What does the aftercare look like for UltraClear?
Yeah, so that's actually a good thing to bring up. For most folks, you're going to be getting distilled water and just some vinegar, and you're going to be doing some vinegar soaks starting the day after the laser, because that's going to encourage the skin to peel. One thing that I've gotten complaints about in terms of just like how it feels after is my patients are like, oh, it feels like my skin is really tight for those first 2 to 3 days. And that's because basically what we've done is we've very selectively and in a precise manner burned some of the skin, and it needs to peel off. So it's kind of like it just has a cast on it and it feels tight. The vinegar soaks to help to encourage that to start peeling. And then you're going to be using Aquaphor essentially to to coat this area, keep it moisturized. One important thing is if you have a history of cold sores, we put everybody on a preventative medication so you don't have a breakout after the laser. We do not prescribe pain medication for this. It has not been an issue. People go home, they say their skin feels a little bit spicy. You're welcome to take a Tylenol if you'd like. We don't necessarily want you having pets in the bed with you afterwards because, and then I actually have a YouTube video about this coming out tomorrow, but you don't want pet dander or a pet to lick your areas that are healing because that can lead to an infection because the type of bacteria that a pet might have in their saliva is not going to be what your body needs afterwards. So those are the kinds of things you want to be careful about right after the laser. If you get more of a advanced treatment, like an UltraClear or a laser coring, like our patient did that we showed the, I think, fantastic before and after results for, you're going to be super swollen on days 2 and 3, and you're not going to necessarily look like your normal self. And some people swell more than others. I've had patients where they send me their picture at day 2, and I'm like, is this the right patient? Because I swear I like just bombarded you with the laser and you look totally fine. But some people will swell up a lot. So I don't want to minimize that. You want to plan for this, and you don't necessarily want to be, going on a trip the next day or something like that.
Yeah, absolutely. Thank you. All right, so here's another good question. Can you go out in the sun after the treatment? So, i.e., can I do it during the summertime?
Yeah, good question. You do want to be careful about that because, especially if you have kind of that redder quality to your skin, the redness can persist longer if you get out in the sun and can potentially cause some issues with pigmentation afterwards, after the laser. I tell folks you can start wearing sunscreen at day 4 or 5, as long as you're careful and you've got a big hat on, sunglasses, and things like that. You can be out in the sun, but please don't go lay on your roof and have the foil thing like reflecting the sun at you. That is going to lead to problems. And actually, it's important to know that you don't necessarily want to have gone down to Lake Powell if you live here in Utah and gotten a ton of sun for like 2 weeks before the laser, because you want your skin to kind of be quiet and not sunburn right before the laser, and have about a week to 10 days, maybe even 2 weeks if you can, where you're not getting a lot of direct sun on the face right after the laser.
Okay,
Would you
that's really
say that's true, Risa?
Yeah, so you can get this in the summer, absolutely, but as long as you're comfortable for the next week or two, kind of, yeah, not going to Lake Powell and not laying out in the sun and trying to have a bunch of pool days.
Yeah,
But
and I have had patients who go on a cruise like a week later and they do fine, but
yeah,
I just want everybody to have the best outcome. So I'm going to tell you what is going to be the
yeah.
safest, but everybody does different things.
I'm one of those people too. I went to Disneyland, I think 10 days after mine, and I was nervous, but I just wore a humongous hat and sunglasses and a lot of sunscreen. And it worked.
Yeah.
All right, so can you do laser coring ultra clear for severe laxity? And is drilling similar to coring?
Yeah, so drilling is similar to coring, and that's essentially what the laser is doing. Is it's kind of putting little spots down in a circle and kind of going down almost like an oil rig, deeper and deeper into the skin, and we can adjust those parameters with the device depending on your skin. And essentially, it's like coring the skin. It's going to be something much more intense than microneedling, for example. And we don't use, we don't have to use heat. So microneedling often has radio frequency associated with it, which is essentially heat, thermal energy. And that's just going to be straight heat for like plugging it into the outlet in the wall there. This is going to be more drilling down with some alternating areas of cool so that we can safely treat that area of skin and not deliver so much heat deep into the skin. So the laser coring is something that, like, sequence wise, if you're having like the full 9 yards type of treatment, we do the laser coring first because we want to lay down those tracks of getting deep into the skin and laying the groundwork. It's almost like aerating your lawn so that we can get the lawn to be better on top of it, and then we go over it with the UltraClear.
That's a really good analogy. I like that. All right, you guys have great questions. Keep them coming. Here's a new one. So does UltraClear act like intense pulse light, or is it more like a resurfacing laser?
It's more like a resurfacing laser. The intense pulse light definitely has some utility, and gonna it's gonna kind of be for different things, like maybe for more vascular lesions and things like that. But the UltraClear is a different device. It's more of a resurfacing device, kind of like a CO2 or a TRL. There's all these brand names, and I don't, I have a hard time keeping track of all of them, but basically the general categories of lasers are like CO2, erbium, IPL, which is going to be, sometimes for people who have dry eyes and blepharitis and things like that. And then the UltraClear is kind of in its own category where it does have that laser pouring mode in addition to some of the things that the CO2 can do.
Got it. Do patients get any inflammatory acne like papules after coring, despite being on antibiotics and treatment for potential rosacea or infection?
I haven't seen that. It's possible, but it's a good point. If you have very inflamed skin, or if you go to a dermatologist regularly because you have rosacea or severely red skin, we want to get that under control before you embark on something like this, and kind of correspond with your dermatologist to make sure it's going to be a good idea. I have taken care of many patients who have had lasers who have skin conditions, and you just have to be mindful of it. So bringing that medical history to your consultation so that we can be aware of what background you bring does help.
Got it. Here's a good question, especially for the oculoplastic. So, how do you protect the eyes when you're using the laser around the eye area?
Yeah, I don't have them right here, but basically there's two ways to do it. We can put goggles on your eyes that you kind of saw in that video. He had the stickers on the eyes. We have these metallic goggles, but since I'm an eye surgeon and I work with the eyes all the time, we actually have these specialized metallic shields. They're like contact lenses, and that way we can protect the eyes. But unfortunately, also we want to get close to the eyes. We want to treat some of those wrinkles under the
Yeah.
eye, and that's, yeah, like especially almost right up to the eyelash line. And that is what I do every single day, is work on people's eyes and do surgery on people's eyes while being close to the eyes, keeping the eyes safe, but working on the eyelids and improving those areas. We use these contact lens shields, especially if we're doing treatments under the eyes, so that we can get close to the eyelash line while still protecting and keeping you safe.
Wow, so you really can treat right around the eye area, the
Yeah,
eyelid.
we even treat the upper eyelid area. I didn't go into that at all, but especially if you're a young patient, you just got like that pinch laxity where you're not necessarily having a huge fold going down
Mhm.
over your eyelashes, but you've got that you just feel like the skin up here under your brow is lax. Well, I'm going to tell you, I'm not going to take the skin under your brow out, because that's not an area that's going to heal that well. I very occasionally have to do that on some of my older patients, but that's not where we put the incision for an upper eyelid surgery. So if you're getting laxity in that area up there, that's an area where we can core and treat and just kind of give an overall tightening effect. So it's not just the lower eyelids, even though we didn't have any pictures of it.
So, how would you decide if someone's a candidate for ultra clear for around their eyes or if they need surgery?
Great question. So sometimes they're complementary and we do both. Basically, when you come in for a consultation, I always talk about let's just talk about the lower eyelids for a second. If we're talking about the lower eyelids, we got to go layer by layer. So front to back, I first talk about the skin, and that's where I talk about, are you bothered by the wrinkles in your skin? I have a lot of men that come into my practice and they're like, no, I don't care about the wrinkles. I'm wrinkled. Who cares? And they're bothered by the dark circles and the bags under their eyes. And that's the big differentiator is, are you bothered by the wrinkling and the lines under your eyes that you might have? Or are you bothered by the dark circles, or both? And if you're bothered by both, then our treatment plan has to include a little bit of both. Because again, I do not often take skin out from underneath the eyelids, because I'm the one that people come to when they have a problem from having that had been done elsewhere, when they can't close their eye or their eyelid gets pulled down to their cheek, which is, again, it's emotional. So if you're bothered more by the bulge or the bags under your eyes and you don't have as many of those wrinkles, then we're talking about surgery. Or a lot of people have volume loss in the cheek area. And then we're talking about things like fat grafting, where we bring fat back in to kind of rebuild the cheek in the lower eyelid area. That's different than if you're bothered by the wrinkles under the eyes. And so I view this as part of what I treat, but it's not like it's something that I want to use or need to use on every patient.
All right, that's really helpful. But that's so if someone's not sure, it sounds like they could come to you and you could help break down what you can do non-surgically with lasers, what you could do with, Botox or fillers, and what you could do with surgery and help them pick the right option.
Yeah, absolutely. And we do teleconsultations as well, because we live in an area where people come from a long way to see us. And so we have a way that you can send us photos and describe what your concerns are around your eyes. And for the most part, when so people will have a consultation with me over telehealth. We'll talk about what my best guess is for what the treatment plan is going to be. And I always say, I might need to change the treatment plan when I meet you in person, because when I see what your eyelids or your these areas look like in person, I might say this is going to serve you better. But I really haven't had to change the plan very often. Usually, we're pretty spot on in terms of what we predict we're going to need to do versus what we actually do.
Got it. So, does UltraClear, let's see, do you recommend great skin resurfacing before someone might consider surgery like a facelift later?
Good question. So,
Or
it
eyelid surgery?
Yeah, it depends. So it depends. If you have a lot of the fine wrinkling of your skin, then if that's what's bothering you the most, then you can do an UltraClear treatment before a bigger treatment like that. Some facelift surgeons do a facelift and do a resurfacing laser on the face at the same time as the treatment. Some space it out where it's months later, because there are some risks in some ways to doing laser over the areas where they have to pull the skin up. So it kind of depends, but you want to have that conversation on an individual level. One thing that I get asked is this going to destroy all the fat under my skin? So I think that's a really important thing that's really trending right now, is like facial volume, collagen, not necessarily taking away all my facial fat, because you want to have fat in your face. You just want to have it in the right places. That's kind of the tricky part. So the laser coring modality, I say for my patients who have skin laxity. So if you have deep and heavy wrinkles in your skin, and especially in areas where there is quite a bit of laxity, like right under the eyes, right around the mouth, that's where we can consider something like laser coring. I don't want to or think I should laser core the entire face, because if we're going to get really deep, and do it in areas where there isn't much laxity, we can affect some of those areas that we wouldn't want to. And so it's kind of a balance between wanting to make sure we have fat in the right places in the face, but also having nice texture and tone to the skin so that there's a harmony between the two of them.
Got it. That's helpful. Can UltraClear treat angiomas or varicosity or palpulsa nigra? I hope I said those right.
Yeah, good question. There are some UltraClear practitioners that use it to treat vascular lesions. I would say that's not what its like superstar or superpower is, but it is possible. It's just not that common.
Got it. Okay. Um, so is it worth doing an UltraClear like this when you're younger, or should we wait until you're older and you have visible wrinkles already?
Yeah, good question. So a lot of my younger patients will do the 3D miracle treatment, kind of like if they do Botox or neurotoxin treatment, almost like a maintenance type of thing, where they want to keep their skin looking fresh, glowing, healthy, and without some of the sun damage. And they're doing that, a couple times a year and that's the one that's, no numbing cream, 1 to 2 days of downtime, a little bit of redness, not the intense treatment that we alluded to with others. So that's typically the category that my younger patients fall into. But some of my younger patients have issues like acne scarring, lines under the eyes, and that's when we can do some of the more intensive treatment. So it really just kind of depends on what they have. It's not so simple to just say younger patients get this mode and older patients get this mode.
Absolutely. And there's definitely you guys may have heard the term prejuvenation, and there is a lot of people kind of trying to do things before they need them. And I mean, would you say it's easier to treat the wrinkles before they get too bad, right? The sooner they
Definitely.
start, the easier.
It's much harder when somebody has super, super deep lines around their mouth because, again, there's no surgery that cuts out skin around the mouth to tighten that area. And so, ideally, if you're able to do it, the more you're able to do to try to kind of prevent those from becoming really deep crevices, the better you are, more likely you are to not have those deeper wrinkles as you age.
Age more gracefully.
Yeah,
Suspend yourself in time, right?
that's right.
Yeah, and push out the time to you may never ever need surgery, hopefully, as long as
And it's not so much about like, aging gracefully or, wanting to stop the aging process, because obviously that's impossible. But I focus a lot on a lot of my patients. I mean, especially here in Utah, they're super active. They're doing things that 30-year-olds are doing and they're in their 70s. And so there's this disconnect between how people feel as far as how old they feel on the inside and what they're able to do versus what some of the, textural areas of their skin are showing as far as what they might look like with their age. And my goal is always to just try to restore that imbalance. And kind of like in that video of our testimonial is just giving a little bit more confidence. Already a
Mhm.
beautiful person, so why not just make them more confident?
Absolutely. Yeah, and I think it's kind of just about your overall skin health too and your skin quality overall. I know as soon as I had my Ultra Clear, I stopped needing to like go and that Facetune app and smooth out my skin as much. And I'm young. It's not like I had very deep wrinkles, but it definitely made me feel better. And I very much prefer not editing every single photo that I have of my skin.
And that's what I was saying at one point is like the funny feedback that I didn't expect after getting starting with the laser is how many people tell me that their skin just feels softer. It just
Yeah.
feels better. And that's not something you can quantify, but it's important.
And your makeup goes on so much smoother too.
I wouldn't be able to speak to that, but
I
yeah,
promise.
that it does.
Here's a great question. So, how often can you do the 3D miracle?
So, I mean, there are people that do it every month. More commonly, it's going to be like if you happen to be somebody that also does something like Botox or Xeomin or Dysport, doing it every 3 months. And just thinking about doing it when you're not going to be giving yourself a ton of sun exposure right afterwards. It's a great little maintenance.
Mhm.
Sometimes people call it the lunchtime laser because you can literally just kind of come in on your lunch break, have no numbing cream, get it done. 10 minutes is the typical treatment time, and then you're out of here.
Absolutely. All right, the hot topic question. Have we talked about cost? I'm sure everyone's curious. What can you tell us?
I thought the hot topic was going to be Chris Jenner. That's what everybody.
That's a good one too. Was it
Yeah,
all ultra clear?
he thinks no. So cost. So it kind of depends on what you're looking at in terms of what you're trying to do. So for some people, if they're thinking about more maintenance, the 3D Miracle is going to be in like the 6 to 7 hundred per treatment. And if you're talking about, I want to do something that I have the time, I want to really do a more longer lasting treatment. It's going to buy me some time. I want to do an ultra clear or a laser coring. That's going to be in the kind of 4 to 5 thousand range, depending on what areas we're treating. If we're just treating around the eyes, so that's somewhere in the $2,000 to $3,000 range. Just trying to kind of give you an idea of price. Hopefully that's helpful.
Yeah, it's really helpful just to have some gauge. And I don't know, it's hard to put a price on, having yourself feel so much more confident in your skin, but thank you for sharing. All right, how long should I wait to work after my treatment?
Depends on what kind of treatment you have. If you have 3D Miracle, you can just tell everybody that you got a little bit too much sun. That's kind of how it looks. It's just like you were, down at Lake Powell for a day. If you're having the Ultra Clear, I would say that we often do them on Fridays. And so if you take the weekend and maybe a day or two after, that would be in the safe zone. My patients who have had it have kind of, and again, I get some of these patients where it's like, they send me their 2 day picture on Sunday, and I'm just like, what nothing happened. And so it kind of depends, but for the most part, people are pretty swollen in that day 2 to 4 range. And so you probably don't want to be out and about until about day 5. On the other hand, I had patients who were like, yeah, I had this dinner party on Saturday, the day after, and I went, and everybody was just kind of wondering what I had done. They were asking me about it. It was kind of a fun topic of conversation for the dinner table. So who knows?
Exactly. You know, and if
But
you were
the point is, they could go to the dinner party and they could go to the grocery store and they felt up to it. It's just that they had a lot of swelling. That's all.
exactly. And I think, you know, if you work remotely over the computer, you know, you can go back to work as soon as you're comfortable showing your face.
Yeah.
I burn through Dysport and Botox. I metabolize it quickly. Will that maybe help allow UltraClear to last longer? Could that be related to this?
That's a hard one. Burning through neurotoxin quickly may be related to dose, and this is a different topic than UltraClear maybe, but it could also be related to there are very rare patients that actually have antibodies to those things, where if you've had it done many times, you can develop a resistance to it. UltraClear is not necessarily going to help with that specifically, but it might be that you need to try a different neurotoxin. And actually, there are more neurotoxins coming onto the market. Botox has a tremendous brand, and they've been the dominant neurotoxin here for many decades. But there are other options. So you might just want to try a different neurotoxin. There are some others out there.
Absolutely. Um, and then one more question. How long do I need to wait to work out after my treatment? They meant work out, not work. Not go to work.
Yeah. So it kind of depends on what you're doing. So what I like to tell people after surgery, which is true for the UltraClear as well, is if you want to go outside for a walk or a hike, as long as you're not getting sun, and get your heart rate up for that first week after any kind of procedure, I'm totally okay with that. For an eyelid, forehead lift, fat grafting, lower eyelid surgery, I just don't want you doing something that's going to cause you to strain. That's called Valsalva. So an example of a Valsalva maneuver is like a downward dog in yoga, straining with a bowel movement, lifting a heavy weight, like you're trying to set a personal record on the bench press. Those are things I don't want people doing in the week after surgery. And in general, for the UltraClear, it's the same, probably even less restrictions in the sense that you can move around, you can get blood flowing in your body. And it might just be that you might not want to be seen at the gym if you're super swollen, because it's like a different kind of swollen, like being really strong at the gym. But that you can go to the gym and you can be active. So many of my patients are just crazy active, much more so than I am. And so this is a very common question I get, especially as regards to surgery.
Got it. All right, guys. So I want to be respectful of everyone's time. So we're going to wrap up now. But Dr. Eftekhari, thank you so much for taking this time after your long day of clinic and surgery to educate us on UltraClear and answering as many questions as we did. To everyone that tuned in, we really appreciate you taking your time, no matter what is going on, you know, whether your kids are already out of school or you're in the last week of a million activities or anywhere in between. We appreciate your time. I
I'm
just
right
paid,
there with you if you are.
huh?
I said, I'm right there with you if you are.
I know, me too. I just popped in the chat our phone number to text. So for the promotion, if you guys can text, you can start getting on it because it isn't unlimited. So please get in and book your treatment so you can you are eligible for the 20% off and 20 units of Tox. And, our phones are off now because it's after hours, but you can call in the morning if you have any questions. Of course, we do offer complimentary consultations. And in case I didn't make it clear, you guys, Dr. Eftekhari actually does these treatments himself. So that's pretty unique. Most places, they're being done by nurses or assistants. So it is pretty amazing. This is a really good opportunity. And we are just so excited to bring this laser to the community. And we hope you guys all get to experience it. So thank you so much again, everyone that joined us, and we hope to see you at the Eyelid Center of Utah as soon as possible for your consultation for UltraClear. Bye, guys.
Thank you, everyone.